This is NUR 420, Week 13, Video 2, Technology and Healthcare Policy and Practice Implications Continued. Big data in healthcare. It refers to the vast amount of information, the vast amount of health data that's generated from various sources, including electronic health records, medical imaging, wearable devices, and more, all that data. And it's called big data because there's so much of it. It's so velocity, it comes so quickly, there's a huge variety, and it makes it a challenge to manage and analyze using traditional methods. There is, however, big data technology and analytics, which allow healthcare providers and researchers to extract that information as insights so that they can improve patient outcome. The first way is called predictive analytics. Big data analytics what they do is they identify pattern and trends in this huge volume of healthcare data, allowing for the prediction of outbreaks of diseases like measles and other diseases, looking at patient outcomes and treatment responses. This predictive analytic allows people to intervene early to improve care because it's predictive. Personalized medicine, it can analyze individual patient data, such as your genetic information, lifestyle factors, your medical history, to make a tailored plan just for you and your unique characteristics. It's known as precision medicine, and it can lead to more effective treatments because it's targeted. And then population health management, big data analytics can help healthcare providers identify and manage the healthcare needs of a whole population or a specific population, such as patients with chronic diseases, maybe COPD, patients who are at risk for developing a certain condition. They can analyze that data and can implement preventive measures in that community with those populations to improve health outcomes. It can support your clinical decision making. It provides healthcare providers with real-time evidence-based insights at the point of care, making informed decision making more accurate, decisions about a diagnosis, treatment, or how to manage the patient. Research and development, there is so much information out there in big data analytics. It can look at that very quickly and analyze these huge data sets to identify new drugs, understand disease mechanisms, improve clinical trials. This can lead to either development or the more quick development of new treatments and therapies. And then healthcare operations and efficiency. It can optimize healthcare organizations' operations. It can look and find inefficiencies, cost issues, and improve resource allocation. They can help a hospital predict admission rates at a particular time, making them staff accordingly. So it has the potential to revolutionize the way healthcare is delivered, improve patient outcomes, and make everything more efficient. And that is so important when you think about how expensive care is and how important positive outcomes are. What are the legal and ethical considerations? Well, the first thing you would think, you have to collect this, you have to store it, and use this data. So privacy is huge, and you need to follow the legal framework such as HIPAA to make sure you're collecting, storing, and using this data following privacy laws. Security. It has to be secure to prevent unauthorized access and other incidents. And so there has to be robust security measures. When you think about it, hospitals and schools are the biggest targets sometimes of people trying to hack into systems and ransomware, etc. So security and putting up those firewalls is huge. Informed consent. You have to make sure that if patient data is being used as part of big data sets, that the patient knows what's being used, how it's being used, so that they can make an informed decision. And then data quality. You need to make sure that the data that's part of big data is of quality, it is true, for those insights to be accurate and reliable. So you have to make sure data collected is accurate, up to date, and relevant. Data ownership. There's a question about who owns the data collected in healthcare systems, particularly when it's used for research. There needs to be clear policies in place, and this is especially true if the data is used in a manner that is going to cause some income. It's going to cause money to be made. Data sharing. There needs to be policies in place about sharing data with third parties like researchers, other providers, and patient privacy must always be protected, and you have to anonymize, make sure that there's no inkling in that data of who that patient is. Bias and discrimination. Big data, like all data, can be susceptible to bias, which can lead to discriminatory outcomes. You need to take steps to make sure that bias doesn't occur and that people don't use big data to provide unfair treatment of individuals or groups. And then transparency and accountability. They need to talk about how they're collecting data, what the practice is, how they are protecting that data, and they have to be accountable for the decisions they make based on big data analytics. So that is about storage of big data. It's scary because there is a huge amount of information out there, and we want to make sure that it is private, because ethically, and because breaching that privacy can come with a huge cost. Challenges. Ensuring that patient privacy and data security, now that we have this big data, there's some challenges. The first is that there is so much information and it is so complex. The next is, how do we share the data and make sure that different users can use that data? De-identifying the data, making sure that there is nothing in the data that can link it to an individual. But that can be challenging because sometimes you have to have re-identification techniques to use the data in some manner. So, but making sure that the fewest number of people, only people who absolutely have to know whose data is whose, know that. Data breaches and cybersecurity threats, it's a huge issue, and ransomware, and people, you probably know too, because I don't know about you, but I receive letters all the time that my data, I've been part of a data breach. So I myself make sure that I have, I purchase software, programs to monitor my data to make sure especially my financial data, to make sure that it's not used incorrectly. And consent and trust. We have to maintain trust. There has to be informed consent, and figuring out how to do all this with all this data is challenging. Making sure you comply with regulatory agencies such as HIPAA and GDPR. That's the European version of HIPAA, in case you're wondering. It was on a previous slide. Making sure that we're using that data ethically and with respect for the individual's rights. It can be challenging. We need to make sure that the data we use aligns with ethical principles. And then data governance and accountability, establishing clear data governance policies and mechanism for accountability. It has to happen to make sure that patient privacy, data security are upheld. But this can be very complex, especially in a large healthcare organization. So the biggest challenges is ensuring patient privacy and data security, and these challenges need to be addressed if we're going to use big data. The next topic is social media, and I know most people have some sort of social media presence. Social media in healthcare settings has grown in recent years. It has some benefits, but it can be challenging. It can be used for communication and education on a variety of topics. Social media platforms are used to engage with patients. They're used for like online support group, creating virtual communities, trying to get to foster engagement and support. Social media can be used for health promotion and awareness, professional networking and collaboration, such as, when you think about LinkedIn. Recruitment and marketing. I know the college and healthcare organizations use social media as a way to market, especially to specific demographics. At research and data mining, there is all kinds of information in social media that can be extracted. Challenges and risks, though, despite its benefits, using social media in healthcare has risks. The main one being violating privacy. Another big one being misinformation. Gosh, there is a lot of misinformation out there. People who are not really who they say they are sharing information, and we've seen that a lot in the past 5 years. And then you have the risk of being unprofessional and being called out if you do that on social media. We have to make sure that we adhere to professional guidelines, maintain patient confidentiality, and that we are very responsible when using social media. And then regulatory compliance. If you're using social media, you have to make sure you're complying with things such as HIPAA. It offers many benefits, including improved communication, but you really have to be careful because it's easily abused. Legal and ethical issues related to social media. Patient confidentiality. You need to make sure that you don't disclose anything that can be tied to a patient, or you can be in big trouble. People sometimes think that they're not, but you go online, and I think a nursing student in Kentucky went on one of the platforms during clinical and was talking about what a pain in the butt their patient was, and the patient's family. She didn't necessarily disclose anything, but the patient's family saw her post and knew that they were talking about their father and complained to the school, and the patient, I think the student if minimum failed the course. She may have not been allowed to go back to that hospital and may have been kicked out of the program, depending. Professional boundaries. You need to be careful because you don't want to share opinions on patient cases, or you need to be careful forming personal relationships with patients online, which could be inappropriate. Privacy settings and security. You need to be aware that who can see what you're saying. Like the student that I was talking about didn't realize that she didn't have any privacy settings on, so anybody can look at her social media site, and that's how the family just happened to try to find her, because she was taking care of them and they saw what she posted. And then a big problem is misinformation and medical advice. You have to be so careful if you are talking about something that it's evidence-based. You need to be aware for yourself and for your patients to make sure people know that they are correctly evaluating information, because A lot of people can post anything online, and a lot of it is not true. Your professional reputation, you need to be mindful that people will see you. And I am telling you, not just on social media, but what you do in public these days, they will find you. I can't tell you how many times I've read stories or seen things like somebody has behaved badly in public and been recorded, videoed, whatever we call it these days, and the internet has led it back to found out where they were employed, and they ended up getting fired. So you need to be careful. You don't want to disclose too much about yourself. Advertising and endorsements, you've got to be aware that there are regulations regarding endorsing medical, medical treatments or supplements or whatever. You need to know if there are any relationships or financial interests that may influence your posts. I can't just go online and talk about drug A is the best thing in the world and talk about it without disclosing, as a nurse, disclosing that I'm being paid by whatever product is asking me to provide a testimonial. Dual relationships, you want to watch your current and former patients, and in our case, we talk about former students and current students. That you don't want to get dual relationships where you're not just their educator, you're not just their healthcare professional, but they see you as their friend, because it can cause a compromise to patient care and confidentiality. And then you need to know the legal obligations and regulations governing the use of social media related to patient privacy, confidentiality, and professional conduct, especially what your employer's rules, what your school's rules are related to social media. How to be professional. The next one, 2 slides, talk about just how to maintain professionalism on social media. I'm not going to go into it step by step. You can read it. But the thing is, you need to follow practices to maintain professionalism and maintain patient privacy on social media platforms, and use them wisely without getting yourself in trouble for what you post. Not just social media, but all technology, healthcare organizations need to create regulations and ethical standards and policies and procedure related to the use of technology. So these need to be developed. They need to have training. They need to make sure that technology is secure. They need to not just say it's secure, but monitor and audit their compliance. They make sure nobody's checking into records that they shouldn't, etc. They need to collect only necessary information. That's called data minimization. And they need to have retention policy, how long they keep information before they destroy it, so that they don't keep it longer than they need to. Patient consent and transparency needs to take place. There needs to be risk management assessments to identify potential risks and try to mitigate them or keep them as keep the agency as free from risk as possible for things such as data breaches, unauthorized access. Collaborate with legal and compliance teams, if something happens, either first to prevent and then to mitigate harm to yourself and the agency if something happens. Stay informed about best practices related to the use of technology. And then we need to have a culture of compliance where the organization promotes ethical behavior, accountability, and transparency in the use of technology. That is it for this week.